Hey, welcome to the Go-To Physio Knee series, part 4. Now, in today's content, we're going to talk about change in direction. So in the previous episodes, we've talked about how to identify the true cause, what tissues are maybe contributing to the pain experience, and how to start our graded exposure rehab program. So by the time we change direction, it's just the next logical step. Everything we teach in the Go-To Therapist Mentorship is the next progression, is the next logical progression, and the patient has earned the right. We don't like guessing, we don't like taking risks, because I've been found out working in professional sport for 12 years, I found out that the hard way. Okay, so in today's episode, we're going to show you how to build out a change of direction program in a step-by-step process so that you don't have flare-ups and you don't have setbacks. I hope you enjoy the content. So when you're designing your return to play program, we have to be mindful of the movements even from day 1, day 2 post-op injury, okay? So when we send this athlete back, and if it's a rugby league player, Gaelic footballer, soccer player, rugby player, whatever, we're going to know they're going to need some kind of change of direction. So what we would have in the back of our mind, okay, and I'd advise you to go back and review the return to play section in the core content, is the step-by-step progression that ideally we need to go through. Okay, so when we're returning an athlete and he has to change direction, mechanically some of the tissues that are going to have to absorb force and produce force will be in this kind of direction here. Okay, so as that athlete changes direction, usually a foot will be planted as they tend to push. Okay, now how much of the foot's planted, whether they're on their toes, etc., it's going to be very, very variable. Okay, so again, we have to take it with a pinch of salt, but this kind of motion here is one that's going to happen a lot. So if I know when I get that athlete to start decelerating and then change direction, one of the first things that I can do prior to that is obviously that foot clock that we talked about, where we're getting the athlete to reach, and we're getting them to reach to maybe a 4 or 5 o'clock, okay? So if you just do that for me, Pete. So early in my rehab, we've done that, okay? And then what I would start to do then later on in the rehab, prior to the athlete actually getting back to change of direction, is we'd just start doing some kind of lunge, okay? So we're gonna allow a lot more force to transfer onto the right foot this time, Pete. So you're gonna start on your left, we're gonna twist, similar, very, very similar to what you've just done. But then I want all my weight to be accepted onto my right foot, okay? And then I want you to push back again. So you're gonna load it and then push back again, okay? And push, that's it. And push again. Again, I'm looking at the athlete. Pete's head's down now, so look straight out in front of you, Pete, as you do it. That's it, and then come back again. Nice and fast, nice and snappy, good. Okay, good stuff. So what that's gonna do then is that's setting the system. It's putting these tissues under specific loads in a graded exposure. So by the time we get to here, he's already experienced these tissues and these movements and the bones moving in these particular ways already, okay? So we have some kind of graded exposure, okay? So then when I get to my deceleration and I have to do these movements, Pete's already gone through them, okay? So what I might even do then is I might go, okay, Pete, we're gonna start on your right foot, I'm gonna lunge, accept weight here, and then I'm gonna accept weight onto my right foot, back again, okay? So you're gonna lunge, accept, pivot, twist, land here, okay? So then I'm building up the ability to decelerate, change direction, and then decelerate onto my right foot again. So there's a left foot deceleration, a pivot, a force production through the left foot, and then a deceleration through my right foot. Okay, so you're gonna do a left-legged lunge, and then you're gonna pivot, and you're gonna accept weight onto the right foot. Perfect, good, and back again, okay? This stuff, it doesn't have to be complicated, okay? And again, this is the stuff I would use with a professional athlete, and I've used this stuff successfully for many years. And once we stick to this graded exposure, touch wood, we haven't had too many athletes reoccur injuries or, you know, break down, so to speak, through the return to play, okay? Same again, Pete, a bit more intent this time. Good, pivot, good. Okay, now the thing I noticed with Pete is his eyes are down all the time, okay? So just look out and then look at the direction you're going, okay? Go. Perfect, beautiful, good. Same again, Pete. Good, perfect, okay? Obviously we can change his hand position, okay? So Pete, I want hands up overhead, I want you to do the exact same thing. Perfect, okay? Hands out in front this time like you're tackling somebody, okay? Perfect, okay? So again, even putting his hands in this position, it's going to cause him to recruit different parts of muscles, okay? So when Pete's here, okay? Versus here, when I elevate that rib cage slightly, okay, that's going to make it harder for me to generate torque through the glute, okay? So it's going to put more force through the knee. So Pete then has to do the movement a lot more, generating torque through the quads, the hamstrings, the calves. Whereas if Pete's out here, now that hip angle is in a good position to generate torque, okay? So there's regressions and there's progressions that we can do based on the hands and based on the type of lunge that we do, okay, to get that athlete back to the change in direction. So that's a kind of a sequence that I will be working on with the athlete before they got out onto the field. So then when we're doing a return to play and your change of direction drills, whatever drills you like doing, you will have already done some kind of movement that the system has to absorb force and has to produce force prior to being out on the field. Whereas if we don't do any of this stuff prior to getting on the field and then we're doing it in the field for the first time, you know, sometimes the nervous system can go, whoa, maybe the progressions have just been a little bit too quickly here, I've jumped too quickly. So I'll tell you what, I'm going to give some kind of tightness, I might give some type of pain experience, I might even give some kind of swelling or something like that. Okay, so just keep that in mind, that we want to grade that exposure just nicely. I always you know, compare it to taking off like an airplane versus a quick spike and load. So again, if we've been slowly putting force through that knee in those directions, by the time we get out and we have to change direction, Pete's already been there, he's done that. The system is very, very happy to almost give him the go ahead to produce force and accept force with thoughtless, fearless movement. And that's ultimately what it's all about. So keep that into consideration when you're changing direction. Have you earned the right to change direction in your field sessions? Okay, that's the question I would ask. And that's a nice little drill, and we can progress that again with boxes, etc. We can increase or decrease the force demands on the knee, the hip, the ankle, depending on what hands we use. Again, we cover a lot of that in the mentorship. But for now, play around with these movements, get the feel, see the difference in the positions that you do with your hands and the impact that has on the rest of the body. So there you have it, a very, very simple way that's tried and tested, that stood the test of time for me working in professional sport for the last 12 years. Now, the key things from today's content is the speed of movement and the ability of the patient to do this stuff without any higher center overriding problems. So the patient should be able to do these movements with thoughtless, fearless movement. If there's a bit of a stutter in the movement or there's a hesitation, that's something we need to be aware of, and we may need to regress the patient. For more information, head over to thegotophysio.com. We've got plenty more content there to help you differentiate yourself from other therapists and become the go-to therapist. I'll see you next time when we start to put it all together and we show you how to make sure that the problem does not return again and you can become that go-to therapist. See you then.